Excessive sugar consumption has far-reaching effects on the body, starting with its immediate impact on the brain and extending to multiple organ systems. While sugar provides a quick energy boost, overconsumption can lead to numerous negative health outcomes, disrupting brain function, metabolism, cardiovascular health, and more. Here's a breakdown of how too much sugar affects the body, starting with the brain. 1. Brain. The immediate and long-term impact of sugar. When you consume sugar, the brain reacts almost instantly. Sugary foods cause a rapid release of dopamine, the feel-good neurotransmitter. This rush of dopamine creates a feeling of pleasure and reward, much like addictive substances such as nicotine or drugs. While this temporary boost in mood might feel good, over time, the brain begins to require more sugar to achieve the same dopamine response, leading to cravings and sugar dependence. This can cause a cycle of addiction where the brain craves more and more sugar, much like other addictive substances. In the long term, excessive sugar intake impairs cognitive function and memory. Research shows that high sugar consumption is linked to impaired learning and memory recall, as sugar negatively affects the hippocampus, the part of the brain responsible for memory formation. Some studies even suggest that chronic sugar consumption could increase the risk of developing Alzheimer's disease, earning it the nickname type 3 diabetes due to the brain's insulin resistance in the presence of too much sugar. Moreover, sugar highs and crashes can make it harder to concentrate, leading to a phenomenon known as brain fog. This results in difficulty with focus, clarity, and overall mental sharpness. The rapid rise and fall of glucose in the bloodstream from consuming sugary foods can cause feelings of irritability, anxiety, and fatigue. 2. Blood sugar and insulin resistance. After sugar is consumed, the pancreas releases insulin, a hormone that helps glucose enter cells for energy. However, consuming too much sugar regularly forces the pancreas to produce higher and higher levels of insulin to keep up. Over time, this leads to insulin resistance, where cells no longer respond to insulin properly, forcing the body to produce even more. Insulin resistance can lead to type 2 diabetes, a condition where the body cannot regulate blood sugar levels effectively. This results in chronically elevated blood sugar, which can cause damage to the heart, kidneys, nerves, and eyes. High sugar consumption is a primary contributor to the global rise in type 2 diabetes cases. 3. Weight gain and obesity. One of the most obvious effects of too much sugar is weight gain. Sugary foods and drinks are high in calories but low in nutrients, meaning they contribute to a caloric surplus without providing any real nutritional value. Fructose, a type of sugar commonly found in sodas, processed foods, and sweets, particularly leads to weight gain. Unlike glucose, which is metabolized by all cells in the body, fructose is processed primarily in the liver, where it is more easily converted into fat. Fructose also doesn't trigger the body's satiety hormones like glucose does, meaning you can consume large amounts of fructose without feeling full. This leads to overeating and increased fat storage, particularly around the abdomen, which is associated with higher risks of metabolic disorders and heart disease. As sugar is stored as fat, the risk of developing obesity increases, especially when sugary foods and drinks are consumed in excess. Obesity is a significant risk factor for a wide range of diseases, including heart disease, stroke, and certain types of cancer. 4. Increased risk of heart disease. Excessive sugar intake has a direct link to heart disease, one of the leading causes of death worldwide. Consuming too much sugar increases the risk of developing high blood pressure, inflammation, and high levels of triglycerides, all factors that contribute to cardiovascular disease. High sugar consumption is also associated with dyslipidemia, a condition characterized by elevated levels of unhealthy cholesterol, LDL, and low levels of healthy cholesterol, HDL. Over time, this combination leads to the buildup of fatty deposits in the arteries, a condition known as atherosclerosis, which increases the risk of heart attack and stroke. Additionally, sugary diets are known to cause chronic inflammation, which puts extra stress on the heart and blood vessels. Chronic inflammation damages the inner lining of the arteries, contributing to plaque buildup and narrowing of the blood vessels, making it harder for blood to flow. 5. Liver damage, the fatty liver. Risk 1 of the lesser-known but significant effects of too much sugar is its role in causing non-alcoholic fatty liver disease, NAFLD. As mentioned earlier, fructose is metabolized in the liver, and when consumed in excess, it leads to the accumulation of fat in liver cells. This can result in fatty liver, a condition where the liver becomes overloaded with fat and cannot function properly. Over time, fatty liver can progress to more severe liver conditions, including liver inflammation, scarring, fibrosis, and even cirrhosis, which is permanent liver damage. The liver's inability to process sugars efficiently can also contribute to increased fat storage throughout the body, exacerbating obesity and related health conditions. 6. Immune system suppression. Excess sugar weakens the immune system, making it harder for the body to fight off infections. Studies have shown that consuming a large amount of sugar can reduce the ability of white blood cells to engulf and destroy bacteria for up to 5 hours after sugar intake. This immune suppression can lead to more frequent illnesses such as colds, the flu, and infections. Moreover, chronic high blood sugar levels can promote inflammation, impairing the body's ability to mount an effective immune response. Long-term inflammation caused by high sugar intake is linked to autoimmune diseases and an increased risk of chronic infections. 7. Skin aging and acne. Too much sugar can take a toll on your skin. High sugar intake causes a process called glycation, in which sugar molecules bind to proteins like collagen and elastin in the skin, forming harmful compounds called advanced glycation end products, AGEs. These AGEs damage the proteins responsible for keeping skin firm and youthful, leading to premature wrinkles, sagging, and overall skin aging. In addition to accelerating the aging process, high sugar consumption can contribute to acne. Sugary foods cause a spike in insulin levels, which increases the production of sebum, oil, and androgen hormones. These hormonal changes can lead to clogged pores and inflammation, causing acne breakouts. 8. Dental health, cavities, and gum disease. Perhaps one of the most well-known effects of sugar is its detrimental impact on dental health. When sugar is consumed, it interacts with bacteria in the mouth to form acid. This acid attacks the enamel of the teeth, leading to tooth decay and cavities. The more sugar you consume, especially in sugary drinks and snacks that linger on the teeth, the more likely you are to develop cavities. Excess sugar also increases the risk of gum disease, as sugar fosters an environment in which harmful bacteria thrive, leading to inflamed gums, infection, and potentially tooth loss if not properly managed. 9. Digestive issues and gut health. High sugar intake can negatively impact gut health, particularly by disrupting the balance of good and bad bacteria in the gut microbiome. Sugar feeds harmful bacteria and yeast, such as Candida, which can lead to an overgrowth of pathogens and contribute to issues like bloating, gas, and irritable bowel syndrome, IBS. A diet high in sugar can also contribute to the development of leaky gut syndrome, where the lining of the intestines becomes more permeable, allowing toxins and bacteria to enter the bloodstream. This increases inflammation and may trigger autoimmune diseases or food sensitivities. 10. Mood swings and energy crashes. While sugar can provide a quick boost of energy, it's often followed by an energy crash. After consuming sugary foods, blood sugar spikes, followed by a sharp drop, leaving you feeling tired, irritable, and craving more sugar. These frequent fluctuations in blood sugar levels can lead to mood swings, fatigue, and anxiety. Additionally, over time, sugar has been linked to depression and other mental health issues. Studies have found that people who consume a diet high in added sugars are more likely to experience symptoms of depression and anxiety, likely due to the sugar-induced inflammation and hormonal imbalances in the brain. Too much sugar in the diet affects nearly every organ and system in the body, starting with the brain and extending to the heart, liver, immune system, and more. While sugar is a quick source of energy, chronic overconsumption can lead to serious health issues, including cognitive decline, diabetes, heart disease, and premature aging. By reducing added sugars and focusing on whole, nutrient-rich foods, you can improve brain function, maintain a healthy weight, and protect your body from the harmful effects of excessive sugar.